So, are you listening to me or not? Yes, I hope you are listening. In previous video, we were unable to record the audio, and we discussed up to this. Now, again, we see retinal vein occlusion quickly. Central retinal vein occlusion is due to primary thrombosis. Branch retinal vein occlusion is due to secondary thrombosis at arteriovenous crossing. So you can see central is due to primary and branch is due to secondary thrombosis. These secondary thrombosis could be sclerotic, arteriolar, compress adjacent venules, causing turbulent blood flow. Fundoscopy shows retinal hemorrhages and venous engorgement, blood and thunder appearance, as you can see in arrow E. So let us see E. This is the E picture. Yes, these collectively showing blood and thunder. Retinal vein occlusion. Yes, the retinal vein occlusion. The frontoscopy shows retinal hemorrhages and venous engorgement, and retinal edema is in affected area. So you can also see retinal edema. The next thing is retinal detachment. Very important. It is separation of neurosensory retina from the underlying retinal pigment epithelium. There is loss of choroidal blood supply, which would result in hypoxia and degeneration of photoreceptors. There are two types, rhegmatous and non-rhegmatous. Rhegmatous is more common and it is due to retinal tear, most often associated with posterior vitreous detachment. It has increased risk in advanced age and high myopic conditions. It is less frequently traumatic. Non-rhegmatous, it is less common and it may be tractional or exudative fluid accumulation, and commonly present with symptoms of posterior vitreous detachment. You can see floaters and light flashes followed by painless monocular vision loss. Dark curtain, you can see dark curtains. So fundoscopy, opacification and wrinkling of detached retina. These are the features we can see on fundoscopy. Changed in vessel directions, emergency, it is a surgical emergency. Opacification and wrinkling of detached retina in picture F, we can see it. What is picture F? Yes, wrinkling. You can see here the wrinkles of detached retina. So the next is retinitis pigmentosa. It is a group of inherited dystrophies causing progressive degeneration of photoreceptors and retinal pigment epithelium. So it is a progressive degeneration of photoreceptors and retinal pigment epithelium. So it is collectively called as retinitis pigmentosa. May be associated with A beta lipoproteinemia. Early symptoms are night blindness, nyctalopia, and peripheral vision loss. Fundoscopy shows triad of optic disc pallor, retinal vessel attenuation, and retinal pigmentation with bone spicule shape. Retinopathy of prematurity, there is preterm birth, loss of normal hypoxic environment in utero, relative hypoxia, increase with supplemental oxygen for NRDS. As you can see, in utero there is hypoxic environment, and when the baby is delivered during preterm delivery, it is exposed to hyperoxia, relative hyperoxia. You can see from hypoxic condition to hyperoxic condition. So there is abrupt proliferation of the vessels in the retina, causing retinopathy of prematurity. decrease VEGF, arrest of normal retinal vascularization as the eye grows, hypoxia of avascular retina. Increase VEGF, retinal neovascularization may cause the retinal tractional retinal detachment, common cause of childhood blindness. So when the child is exposed to relative hyperopsia, there is increased VEGF, vasculoendothelial growth factor, and there would be retinal neovascularization, which would result in tractional retinal detachment, and it is the common cause of childhood blindness. Papilledema. Optic disc swelling is also called papilledema. It's usually bilateral due to increase intracranial pressure. Secondary to mass effect, there would be either increased production of cerebrospinal fluid, or there would be any swelling or tumor of the brain which would result in increase intracranial pressure. Result from impaired exoplasmic flow in optic nerve fundoscopy. Elevated optic disc with blurred margins. Fundoscopy shows elevated optic disc with blurred margins. Retinoblastoma, most common intraocular malignancy in children. It is intraocular malignancy. Arise from immature retinal cells caused by mutation of both retinoblastoma 1 tumor suppressor gene on chromosome 613. Retinoblastoma. You know retinoblastoma, so that I'm not underlining it. Chromosome 13, which normally impedes G1 to S phase progression. So, tumor suppressor gene which impedes G1 to S phase progression is absent. So, there would be no impedation and increased conversion of G1 to S phase and increased mitosis, and there would be obviously you can say increased growth. Can be sporadic or familial. Loss of heterozygosity presents with leukocoria, presence of white reflex. You can see there is presence of white reflex, nystagmus, and eye redness. Leukocoria, it's a loss of red reflex and presence of white reflex. Important causes in children include retinoblastoma and congenital cataract. Yes. Uveitis, increase inflammation of uvea, specific name based on location within affected eye. Anterior uveitis, iritis, posterior uveitis, choroiditis, and or retinitis may have hypopyon. They have hypopyon. Hypopyon is the accumulation of pus in anterior chamber or conjunctival redness associated with systemic inflammatory disorder, e.g., sarcoidosis, Bassett disease, juvenile idiopathic arthritis, HLA-B27 associated conditions. So these are the conditions which would be associated with the uveitis more or less. Bassett disease, sarcoidosis, juvenile idiopathic arthritis.